First, I want to just pay tribute to my colleague Deputy Duncan Smith, who's led for us on this important motion. And as Duncan has said, this is the last Labour private member's motion in the lifetime of this Dáil. It might even be the last private member's motion, Minister. But in any case, we thought it was vitally important that we would put it down on the issue of healthcare, and in particular healthcare staffing. I think we're all conscious what a crisis exists, and notwithstanding the very lengthy government amendment, I think it's about 4 times as long as our original motion, notwithstanding that, I think you could boil it down to saying there are simply not enough staff to provide the adequate and decent level of patient care that all of us would hope to have for ourselves or for our family members. The healthcare system is an issue. Problems with healthcare come up in every constituency across the country. I was in Tipperary on Friday with Deputy Alan Kelly. I heard there from so many people in Nina about their concerns, about their own experiences, their families' experiences with overcrowding, with lack of access to treatments, lack of access to GPs in the area. I was in Limerick on Monday with Councillor Conor Sheehan, and again, huge concerns, huge issues there, of course, with University Hospital Limerick. All of us think of the dreadful, tragic death of Aoife Johnston in UHL, and again, just to extend deepest sympathies to her parents and family. But concerns about access to healthcare are deeply held across the country. And I do also want to pay tribute to the heroism of healthcare workers who are providing services in an underfunded and overcrowded environment, understaffed and overcrowded environment, to our nurses, doctors and carers, but also all those who keep hospitals, surgeries and clinics going, to cleaners, catering staff and porters, many of whom across the healthcare system, as you'll be well aware, Minister, have come from other countries to provide us with the benefit of their skills and expertise, even as we are exporting so many of our own healthcare workers and healthcare professionals. As we face into the winter season, and as Duncan has said, there is a real concern about that, we know that we will see additional problems, additional difficulties, exacerbated by a lack of clinical staff. And it does come down to funding. Last year, the government announced a health budget with a €2 billion hole in it. Bernard Gloucester, the CEO of the HSE, said at the time that the monies allocated were inadequate. And indeed, that was when the Minister, you announced a recruitment freeze during a staffing crisis. Now, this year, we appreciate the cuts have been more subtle. Last year's recruitment freeze has been called other names. I see in your motion you say the pay and numbers strategy is not a recruitment moratorium. It's been called things like a ceiling. But the reality is that we are facing a real shortage of vital frontline healthcare workers. And this at a time when we are already seeing record overcrowding before the winter surge, when 700,000 people are languishing on waiting lists, and when we see a serious over-reliance on agency staff. And I was interested to note that right at the end of your motion, you acknowledge that the agency spend in recent years has been higher than the government would like. That's an understatement. At this time, having begged doctors, nurses, midwives and healthcare assistants not to leave us for Australia, the government has effectively turned around and said, we still can't hire you here. The INMO is repeatedly warning that embargoes and freezes and ceilings on recruitment will send healthcare into a freefall. And we're hearing about serious problems too, where even where sanction is given to fill vacancies, the time it's taking to fill them is too long. It can take up to a year. When someone retires or leaves for another position or takes leave for any reason, positions are not ring-fenced for backfilling. Far too many people having to act up, having to do more work than they have capacity for. And clinical managers with no local autonomy, competing with all other requests in regional health areas. So we have serious concerns, Minister, about workforce planning, and that's one of the issues addressed in our motion. Government representatives are at pains, and I know you've set this out at length in the amendment, at pains to tell us that recruitment is happening. And of course it should be happening, and we acknowledge there is some recruitment happening, but the deficit is enormous. A projected deficit of 49,000 nurses by 2041, thousands of positions vacant, at a time when we see a growing population and an ageing population, with medical needs becoming more complex. And so we do need to recruit more staff. Any of us who go into any emergency department, talk to anyone who's been waiting for appointments, who can't even get to see their GP, it's plain to see there are simply not enough healthcare workers in this country, and it's having real impacts on people. I see it in my own community. I've spoken about the Midwest and the huge issues there, but in Dublin Bay South, those who attend A&E at St Vincent's or St James's Hospital speak of their experience waiting long hours. I speak to those who work in healthcare. I spoke to one agency healthcare worker who would love a permanent job but cannot get one because of the freeze. He said, every day is like your first day on the job. It doesn't make sense to move around all the time. We are paid the same, and a private company takes the cream off the top. Now, Minister, you're saying that there's been additional investment in health services under this government, and again, I know you set out some detail in your amendment, but tell that to the people languishing on hospital trolleys. Or tell that to the people who've been turned away from scheduled appointments at hospitals like St Vincent's, or who are people who are turned away for DEXA scans at the same hospital because there are no staff to run the scan. That kind of thing does not happen in an adequately resourced health service. Patient safety should be the marker for success. But if we want to talk about money and cost benefit, I want to return to that point about agency staff, which again we focus on in our motion. The cost of hiring healthcare staff from for-profit agencies increased by 139% between 2015 and 2022, the sum being €619 million. We know that last year the HSE spent €650 million on agency staff, 3% of the entire health budget. So this is a huge issue when we see workers like the worker I've quoted who want a permanent job but can't get one and continue to be paid therefore through the agency. This issue with staffing is not the fault or the responsibility of the healthcare workers desperately trying to provide a decent service, and clearly not the fault of patients who are presenting at hospitals looking for help. The blame lies squarely at the feet of government, and we need to see adequate resourcing in place and adequate workforce planning to ensure we will have sufficient staff to run decent services through the winter. And these problems go beyond shortages in emergency departments. And it's often easy to focus on hospitals and difficulties with emergency departments because that's very starkly visible. But there are also problems within the primary care system, and I know you're well aware of this, Minister. There's a particular issue in Dublin with public health nurse shortages, meaning children are missing key developmental checks. The lack of access to paediatric speech and language therapists, long delays in initial psychological assessments and follow-up with specialist teams, these are causing real problems for children, delaying the necessary treatments, the necessary services that should be provided. And these check-ups really matter to catch issues early enough to ensure intervention can be effective. And again, so many parents coming to us and speaking with all of us about their huge concerns and fears for their children. So we need to see better planning on child health care provision, on those primary services too. And, Minister, perhaps to conclude by speaking a little about, how visible dysfunction in the healthcare service can be. And I'm reminded of this again every day when I cycle past Baggot Street Hospital. I was there yesterday for an event outside the hospital, and every single person outside the hospital looking at this beautiful iconic building in the heart of the city, HSE owned property, lying empty for far too long at a time when nurses and doctors can't find accommodation. And I think we're all aware one of the issues with staffing and recruitment is connected to the housing crisis and lack of affordable housing for our healthcare staff. Baggot Street Hospital lies empty. Our hospitals are overcrowded. This hospital lies empty. I have a family member who's worked there until into the recent past, providing care to people who needed it. And it's really sad to see it still sitting idle and vacant when we see such shortfalls in housing provision, accommodation provision for healthcare workers, and when we see such shortfalls in staffing in our hospitals and our primary care services. When positions are left vacant, Minister, people are deprived of care, the care that could be provided from those who want to help them. And in a boom, especially in an economic boom, there's no excuse for government policies that underline and reinforce hardship and lack of access. So we need to lift the cap under the pay and numbers strategy, or whatever it's called. We must give local directors of nursing and midwifery the sanction to fill and recruit for vacant posts, and we must legislate for safe staffing in our health services. Patient safety should be the absolute priority in workforce planning, in healthcare planning, in budgetary planning. Minister, níl rud ar bith níos tábhachtaí ná sláinte ar bubble. Tá mé a ggéire ar an rialtas, muoinú cheart a Howard den chorás sláinte. Is fear an sláinte, ná an táinte. Go raibh maith agat.